Hello, this is chapter 21 on pharmacology, which begins on page 253 of your patient care book. Pharmacology is on the registry, just so you know. It is in limited quantity, but they do recognize that as healthcare professionals, it's important for us to understand pharmacology, to be mindful of some of the different drugs that patients may take or be prescribed. And you tend to get a better sense of pharmacology the longer you're in the field, because patients will share with you what medications they take. You can overhear what prescriptions are written for patients depending on what their symptoms are, what they're diagnosed with. So this is definitely something that you get better with time as you're in the field and listen to this. And as far as being on the registry, don't let this chapter overwhelm you. We're just going to kind of touch on the drugs, the different dose forms, the different classifications, and what some of these drugs do. When we look at pharmacology, they start off by defining a drug, which is any chemical substance that produces a biologic response in a living system. Drug is also a substance used as medicine to aid in the diagnosis, the treatment, or the prevention of disease. And the science that's concerned with the origin, the nature, the effects, and the uses of drugs is called pharmacology. When we look at drug nomenclature, drugs can have three different names. Typically, the first name it's given is its chemical name. When it's first created, it is given a chemical name that defines its chemical structure. And then typically the company that manufactures it gives it a trade name, which can also be called a trademark or a brand name or a proprietary name. And that's the name given by a particular manufacturer of a drug. And once it becomes commercially available, a drug is given a generic name. So they give the example in here of a chemical name, which is acetylsalicylic acid. Which is the trade name, the generic name of that would be aspirin. And then a trade name might be the first company that actually came up with that, which was Bayer. So the trade name or the trademark or proprietary name would be Bayer aspirin. But now it is commercially available, so you can buy it in generic form, which would just be aspirin, but the first name it was was its chemical name. They also talk on page 255 about a resource that physicians use called the Physician's Desk Reference, or the PDR. And the PDR can be found in print, or it also is available online. A lot of times the physicians have this as an app on their phone, and what the PDR gives is a summary of drugs listing the classes of the drug, the description of a drug, the common brand name, how it's supplied, its different dosages and indications. It also lists contraindications. And typically that is listed for all FDA approved drugs. And the other interesting thing that you can find in the PDR in the center is typically a picture reference, because sometimes patients will come to the department and bring their prescription drugs, but they won't always be in their prescription bottles. They'll just tell you that they take this 3 times a day. They might not even know what they take it for, but you can usually find it first by color, and then by size, and then by any markings that might be on the pill. You can usually figure out what type of medication the patient is taking based on that. So that is something very helpful in the Physician's Desk Reference. And like I said, it comes in print or it is available online, and they also make it an app for phones. When we look at the different drug classifications and the dosages, this is found on page 254 and 255, but they talk about that drugs can be classified by their name, by their action, or by their method of legal purchase. So they can be classified by action according to this slide here. If they have similar chemical actions, they're grouped into categories called drug families when they're classified by action. When they're classified by their legal classification, then they're either prescription drugs or non-prescription drugs. And non-prescription drugs often can be referred to as over-the-counter drugs or OTC drugs. And another group that is found to be obtained without a prescription are called the dietary supplements. So things like vitamins, supplements, herbal remedies are considered dietary supplements by law, and they're not classified as drugs because they're not controlled by the U.S. Food and Drug Administration. As far as drug families, they are typically classified when they're classified by their drug families, it's typically by their action, like what they do. That would be a drug family. So when they're grouped, all the drugs that relieve pain are considered analgesics. All the drugs that would treat hypertension are antihypertensives, things like that. So classified by action into drug families, and they can be classified by their legal name, and they're also classified by their chemical names. They talk about dosage forms on 255. These are all the different types of forms that a drug can come in. It's the way it's prepared and the way that the chemical agent is transported into the body. And a single drug can come in multiple different forms. Sometimes it's just by patient preference as to how they like to take that particular drug. So the most common oral dose form of a drug is tablet. This is where it's a powder or granulated drug compressed into a solid disc, and sometimes they're a single dose unit, but sometimes they can be cut in half, so the tablet is actually scored so that it can be divided and taken in a smaller dose. An inhalant is where it's in aerosol form and inhaled into the body. One of the biggest things we think of with that, you could think of anesthesia, would be through inhalation, or an asthmatic with their inhaler would also be another form. A suppository is where this dose form is shaped to be inserted into a body orifice, such as the rectum, the vagina, or the urethra, and then once that is inserted, it actually dissolves and releases the drug. Capsules can be another form of medication. This is where it's either a powdered form of the drug or a liquid drug contained in a gelatin shell. And then when the patient swallows that gelatin, the stomach acid acts on the gelatin to dissolve it and thereby releases the drug into the body. A solution, when we think about a solution, typically this is where the drug is dissolved in a liquid carrier, and they're typically rapidly absorbed, and they can be given either orally or parenterally. And when we talk about parenteral administration, that is where it is typically an injection of the drug given with a needle and a syringe below the surface of the skin. A common solution would be saline is a solution where the salt is dissolved in a liquid carrier. You don't have to shake it. It's already in there. And saline is one of the most common things given venously, either to open a line or start a line or along with other medications. A suspension is a dose form where the drug is actually in small particles and suspended in a liquid carrier. Most suspensions are given orally, and the biggest thing about a suspension is it typically has to be shaken thoroughly before it's given. And a suspension, a common suspension would be amoxicillin. Amoxicillin tends to layer out, so before you give a dose, you typically shake the bottle really well, pour the amount prescribed, and then the patient takes it. And the last dosage form they talk about is a transdermal patch, and this is a form that allows the drug to be applied onto the skin surface, and then it gets absorbed into the bloodstream. Typically patches they're given for to stop smoking. There are transdermal patches that provide birth control. There are patches that provide for pain. The biggest thing about a patch is that they usually contain aluminum or other forms of metal, and those metals actually can overheat when a patient has an MRI and burn the skin. So you have to be very mindful and ask patients if they have any transdermal form of medication on them, and that would have to be removed for their MRI. When we look at the drugs and classify them by their actions, this is probably the most that we're going to look at these. And what we're actually going to do is break these down one by one and talk about what they do. So this is not on the slide. You can add this information, but I did not want to spend the added time or the added slides breaking down every single one. So I can tell you these first 5 are found on page 259. And when we look at them like analgesics, typically those are drugs that relieve pain without causing a loss of consciousness. That all the drugs that relieve pain that don't cause a loss of consciousness are considered analgesics. An anesthetic is an agent that depresses the neuronal function and produces a loss of ability to perceive pain and or other sensations. So typically there are 2 types of anesthetics. There are local anesthetics and general anesthetics. And if you think about a local anesthetic, and a good example of that would be like Novocaine when you go to the dentist. They give you the shot of Novocaine in a certain area in your mouth, and that ends the pain while they work on that area of the mouth. A general anesthetic would be something that is given to the patient like when they go into the OR to have surgery, where they are literally put to sleep and they lose the sensation of pain from head to toe. An anti-anemic agent is drugs that are used to treat anemia. And an anemia is an abnormal concentration, like a low concentration of erythrocytes or hemoglobin in the blood, and this is usually the result of an iron deficiency, a folic acid deficiency, or a vitamin B12 deficiency. Any of these that begin with anti mean that they treat that, they go against that. So this is something that's given to go against anemia. An anti-anxiety agent is used to treat anxiety disorders. An antiarrhythmic is used to treat arrhythmias, which is an abnormal variation of the heartbeat. An antibiotic, anticholinergic, anticoagulants, antidepressants, and antiepileptics. Antiepileptics is not in the book, but it is used to treat epilepsy. But the rest of these on this page, beginning with antibiotics, are on page 260. So an antibiotic is a drug that kills or inhibits the growth of microorganisms. So when patients have a bacterial infection, they are given a script for an antibiotic. An antibiotic, however, will not treat a viral infection. A viral infection, you simply have to treat the symptoms of the infection, but an antibiotic will have no effect at all on a viral infection. Anticholinergic is a drug that reduces the smooth muscle tone of the GI tract. A lot of times, the only thing that I can think of that we really talk about as far as an anticholinergic is the glucagon that can be given to a patient when they start to experience colon spasm when they're having a barium enema. Then we can give them an injection intravenously of glucagon that will reduce that smooth muscle tone and stop the cramping. An anticoagulant inhibits the clotting factor of the blood. Actually, what an anticoagulant does is inhibits the growth of the proteins that platelets use to clot. So when it inhibits or stops the growth of those proteins, the platelets can't use them to clot, which slows down the clotting factor. An antidepressant is used to treat depression disorders. And an antiepileptic is not in the book, but those antiepileptics are used to treat epilepsy disorders. The next few, beginning with an anti-diabetic and an anti-emetic, are still found on page 260. As far as anti-diabetic agents, these are drugs that are used to treat diabetes. And if we look in there, diabetes affects almost 26 million Americans in the United States. And typically diabetes can be categorized into type 1, where the patient has absolutely no insulin present, and type 2, where there's an insulin deficiency and insulin resistance. So the only way to treat type 1 patients is to give them insulin. But type 2 diabetics can take medication and use diet to control their diabetes most of the time. One of the biggest things we are mindful of with type 2 diabetics is those patients that take what is called metformin, or the brand name would be glucophage. So glucophage is the brand name, the generic is metformin, and patients that are on metformin or glucophage have to be mindful, and we have to be careful when they come in for a contrast study and they're given injectable iodinated contrast. We have to inform those patients that they are not allowed to take their metformin or glucophage for 48 hours after their injection. They reference that it's associated, metformin is associated with lactic acidosis, which is a rare adverse effect, and it has a mortality rate of 50%. So metformin is supposed to be discontinued after the use of radiographic contrast agents because of its potential negative effects on renal function. It actually can shut down the kidneys. And if you look in your book on page 260, it does say to shut down the metformin before the use of contrast, but I you that the ACR, which is the American College of Radiology, has modified that so that they are not allowed to take the metformin after the injection for 48 hours, but they can take it right up until the day of their exam, but they cannot take it after the exam for 48 hours. An antifungal, antihistamine, antihyperlipidemic, antihypertensive, anti-Parkinson's, platelet, and the psychotics, these are all found on page 261. So again, anti meaning it goes against. So antifungal agents destroy or suppress the growth of fungi. An antihistamine are drugs that are used to treat allergies. An anti-hyperlipidemic, hyperlipidemia is associated with developing atherosclerosis, lead to coronary heart disease. Typically, these drugs are called your statin drugs, and they treat high cholesterol. So an anti-hyperlipidemic tends to treat high cholesterol. These are things like Lipitor, Zocor, all those statin drugs. An antihypertensive treats hypertension, which is high blood pressure, and this actually affects almost 80 million patients in the United States. It's 1 out of every 3 adults have hypertension. And remember, hypertension is the silent killer because there are not always symptoms with hypertension. Anti-Parkinson's agents treat Parkinson's disease. Antiplatelets inhibit platelet aggregation. Typically, these drugs are used to prevent myocardial infarctions, strokes, TIAs. So a lot of times they will use aspirin or Plavix or ReoPro. Typically, an antiplatelet directly affects the platelets, not to be confused with an anticoagulant. The coagulant inhibits the growth of proteins that the platelets use, whereas an antiplatelet directly affects the platelets themselves. And an antipsychotic are used to treat psychiatric disorders like schizophrenia, any of the delusional disorders, acute mania, and agitated states. Anti-ulcer agents and antiviral agents are still found on page 261. The anti-ulcer agents are used to treat peptic ulcers, gastric ulcers, duodenal ulcers, and GERD, which is gastroesophageal reflux disease. Antiviral agents, typically antivirals do not destroy the target pathogen, but what they do is inhibit its development. So you could use those to treat the viral infections, and they reference that these are used to treat herpes simplex, chickenpox, shingles, the flu, hepatitis, and the infection that's associated with HIV. So that would be an antiviral agent. Moving away from the we have the bronchodilators and the coagulants, corticosteroids. These diuretics, hormones, and laxatives are all found on page 262. So a bronchodilator is a drug that treats asthma and chronic obstructive pulmonary disease, or COPD. This medication would dilate or open up the bronchioles. A coagulant is a drug that's used to control hemorrhage or speed up coagulation time or clotting time. A corticosteroid is a drug that's used to reduce the symptoms that are associated with chronic inflammatory disorders, or they can use them for short-term treatment of acute inflammatory conditions. So those are like your hydrocortisone, Depo-Medrol, things like that. Typically injected in a joint when patients exhibit inflammation in the joints. A diuretic would be a medication that increases the amount of urine that's excreted by the kidneys. So this is like your Lasix. When they give patients Lasix, it helps increase the urine production so that they pee more frequently. Hormones affect the endocrine system, and those are typically used as far as hormone replacement therapy. And a laxative, the laxatives are important as far as we are concerned. If you look on page 262, they reference that laxatives promote the passage and elimination of fecal material from the large intestine. We absolutely use them to prep patients for GI procedures and urinary tract procedures because they have to clean out their intestines. And we use things like bisacodyl, which is Ducalox, citrate, Go Lightly, all of these different preps, depending on the patient's insurance carrier, we can use different preps that will remove fecal material from the colon so that the physician can have a better view of the intestinal wall. Okay. A synonym for laxatives that the registry likes to use is the term cathartics. CATHARTICS. Laxatives and cathartics are synonyms for each other. Anti-Alzheimer's drugs, those would be drugs used to treat Alzheimer's disease. A mood stabilizing drug is still on page 262. These prevent mood swings in patients that have manic depressive or bipolar disorder. Our NSAIDs, or non-steroidal anti-inflammatory drugs, these have multiple properties. These have analgesic properties, so they relieve pain, antipyretic properties, so they reduce fevers, and anti-inflammatory actions, so they reduce inflammation. Typically, NSAIDs cause GI irritation, peptic ulcers, GI bleeds, renal failure, and all NSAIDs have a black box warning label on the box that they're sold that says that they can increase the risk for serious and potentially fatal cardiovascular events, such as a myocardial infarction, which is a heart attack, and that the risk can increase with prolonged use. So NSAIDs, be careful if you take any of those because they can cause a lot of damage. And some, I remember specifically one drug that was created by Pfizer was called Vioxx, V-I-O-X-X. It was actually recalled, which was kind of upsetting because the orthopedic I worked for, we used to use a lot of Vioxx. Patients loved it. It was extremely effective. The downside was they started reporting an increased number of patient deaths that were on Vioxx, so they immediately recalled that. And luckily, none of our patients that I know of were affected, but definitely it did work. But obviously, the downside to that would be that it had irreversible side effects that caused death in patients. Osteoporosis drugs are used to treat patients that have osteoporosis, which is a loss of mineral from the bone, making them weaker and increasing the patient to the risk of pathologic fractures. Sedatives or hypnotics Those are used to produce different degrees of central nervous system depression, ranging from mild sedation to sleep. So your sedatives or your hypnotics would be like your Ambien or your Lunesta. A stimulant increases the activity of the brain and the spinal cord. So these are things like your Adderall and Ritalin. Thrombolytics dissolve thrombi or clots that have already formed. So when we were talking about patients that are potential stroke victims, the reason that time is of the essence is because they can actually give the patient thrombolytics that can dissolve the clot so that there is a greater chance of the patient recovering from the effects of the stroke. A vasoconstrictor is a drug that causes the blood vessels to constrict, which raises the heart activity and raises blood pressure. And a vasodilator is the class of drugs that cause the blood vessels to actually dilate or open up. Nitroglycerin is probably the example of a vasodilator. All right, and those were found on page 263. The pharmacokinetics process. Now, when they talk about pharmacokinetics, if we look at that, that's different from pharmacology. Remember, pharmacology looks at the origin of the drug, the nature, the properties, and the effects. Pharmacokinetics actually is the study of the drug's metabolism, the action of the drug, the time it's required to get absorbed into the system, the length of time that that drug actually acts, how it's distributed in the body, and how it's excreted in the body. Okay, so it looks at the absorption, the distribution, the metabolism of the drug, and the excretion of the drug. So as far as the absorption, how does it move from the site of administration into the blood? Once it does that, how does the drug go from the blood to the different tissues and organs that it's targeting? Chemically, how is it altered? Is it altered by the liver to permit excretion? Does it pass through the liver, or does it pass through some other way? And then how is it excreted? How does it get out of the body? Typically, the kidneys are the most important organ for that function, because the kidneys are like big filters that filter things out of the urine before it is excreted from the body. So that is the study of pharmacokinetics. How is the drug absorbed into the body? How is it distributed, metabolized, and how does it get out of the body? That can influence drug action would be the patient's age, the status of their health, when the drug is taken, as far as time of day, the emotional state of the patient, other drugs that might be present in the body that can counteract that drug, any genetic variations in the patient, and the disease state of the body, all factors that can influence how that drug will act on a particular patient. As far as reactions to drugs, there are things called side effects, and these are results that happen from the drug acting on tissues other than those that are intended. So it causes a response unrelated to the intended action. And all drugs have to list their side effects or potential side effects. If you've ever looked at the paperwork you get from the pharmacy, it typically will tell you what the drug is, what its intended uses are for, the side effects of that drug, what to do if you experience those side effects, and who to contact if you have any other side effects. Idiosyncratic reaction is where the drug reaction does not occur in most patients who have been treated with that drug and does not include the therapeutic effects of the drug. So this is an idiosyncratic is a reaction that happens in a person, but it is not the common reaction. It's not common, it stands out. It is the exception, not the norm. The worst drug reaction would be an anaphylactic reaction. This is severe, which brings about respiratory and cardiovascular collapse. This is when a patient is allergic to something and they are given it. They can cause laryngoedema, where the throat swells. It can cause organs to shut down. It ultimately can cause death if not treated or reversed quickly enough. Your sedation drugs, when we talk about those, there are drugs that cause minimal sedation, moderate sedation, deep sedation, and then general anesthesia, where that is the deepest level. So they reference that moderate sensation drugs, which have analgesic factors, or conscious sedation, meaning those are used in medical imaging procedures. A lot of time when patients have colonoscopies, they are given conscious sedation drugs. Sometimes we'll call that twilight, where the patient is out, doesn't really feel what's going on, not really aware of it, but if you needed to have the patient do something, like respond to you or move a certain way, they are lightly sedated so that they could be brought out of that very quickly. Like I said, colonoscopies are a good example of that. They give the patient, I believe, Diprivan, which is a mild sedation analgesic property, so that when they have the colonoscopy, they're not feeling the effects of the colonoscopy, but they also wake up very quickly from that and they recover quickly from that. The deeper asleep you are, the longer it takes to recover from that sedation. In conclusion for this chapter, they want to reference that as technologists, we are expected to have a basic knowledge of pharmacology in order to prepare and administer drugs under the supervision of a licensed practitioner. The PDR, or the physician's desk reference, is usually found in the radiology department, and that lists the drugs by both generic and trade names. I told you there is a picture profile in there. It lists the common names, the common forms of the drug, the side effects of the drug. It shows you what all the pills look like, if they're scored or not, what kind of markings it has. It's a very good reference in print form, and they also have it as an app. Some common dosage forms would include tablets, capsules, suppositories, solutions, suspensions. Remember we said suspensions have to be shaken, and transdermal patches. Also, as technologists, we should be familiar with the actions and precautions that are associated with commonly used drugs. There are different factors that affect the patient's response to a drug, which may be undesirable. That is not always something that we can help, but we need to at least be aware of that. And after they are administered, any relevant information should be recorded on the patient's chart, meaning whenever you give a patient a drug, whether it's an injection or an oral form, anything that is relevant should be recorded. If the patient reacts, if the patient gets hives, if the patient gets nauseous and vomits, if the patient complains of a metallic taste in their mouth, anything that you find relevant that you would not necessarily expect, you want to make sure those things are noted in the patient's chart, so that if they ever have something need to be given to them along those same lines, that whoever is going to give it would be able to see what happened the last time they were given that drug or medication. All right, and that concludes this chapter, chapter 21 on pharmacology. If you have any questions or comments or concerns, please make sure you write those down and we will address them. As far as the drugs, when we looked at the drugs based on their action, again, just very simply stated what the drug does and how it acts on the body is all we really need to know of. Okay, all right, well, I hope you guys enjoyed this presentation, and we will clear up any confusion or any questions when we next meet. Thank you so much.